No, healthcare entrepreneurs is pretty risky. I know Dr. Pratap Reddy said that pattern long back for setting up Apollo.
Those days, as a children's specialist and a specialty doctor, I've done a lot of work to how to come back.
In fact, that's a question I want to ask you because quite often it is said that doctors don't make good businessmen.
When I see a patient and at the end of the patient, this is my consultation. That was a difficult part for it.
Is the fact that you wanted a hospital, a children's hospital, every 250 kilometers. I read that somewhere. Is that concept still in your mind?
If I connect kind of dots of Nellore and Kurnool,
and the public issue that went in, what was the thought process behind going public, sir?
whatever it is, whether trust, including a temple or church and mosque, it has to make money.
After 25 years now in this line, there would be cases where the child whom you took care when they were 2 or 3 would come back to you now after 25 years, grown up, and thanked you for helping out that time, even the parents for that matter. Did you have any such cases?
The girl who's actually, I went and 2000, I went and picked up from Basansani.
Welcome to Conversations on HYBIZTV. I'm Suresh Kochattil. Running a hospital is a tricky business because you need to generate revenue. At the same time, you need to have empathize with the patients. Because in India, profit is still a dirty word, be it in any business. But running a children's hospital is all the more challenging because then the focus is even lesser. In 1999, Ramesh Kancharla decided to set up a hospital for children, and it is appropriately called Rainbow. Over the years, last 25 years, this hospital chain has expanded its scope of operations, set up units in different states, in different cities, and of course, has a target to grow. They even went for an IPO in 2021. And over the time, the company has kept up its revenue path and growth, and of course, a huge satisfied client base. Let's understand from Mr. Ramesh how this journey all happened. Welcome, sir. Namaskar.
Namaste, Andy. Namaste.
Let us start with, you come from Nellore. And Nellore to Hyderabad, how did that journey happen, sir?
It was very interesting. And, from Nellore, I was not from Nellore, I'm from a village in Nellore district. So that my father was an agriculturist and also kind of small-time politician those days. So those days politicians are to help people, so rather than doing politics.
That's true.
So from that background I've come from, and of course my father's dream was to educate his children.
Okay.
So that's what actually resulted in me to be here. My brother to kind of found global hospitals. So both of us have become doctors and also entrepreneurs.
No, healthcare entrepreneurs is pretty risky. I know Dr. Pratap Reddy said that pattern long back for setting up Apollo. But till then, corporate hospitals, so to speak of, was not a kind of common thing. Government hospitals were there, trust hospitals were there. But getting a hospital to run on a professional basis with two things. One, which I described before, one is to keep the patients satisfied. In your case, it was children and their parents. And the other side, you also had to get the revenue so that you could grow further. How did you balance these two out when you started Rainbow, the first unit here on road number 10 in Banjara Hills, Hyderabad?
Actually, I was in London before coming back. I wanted to actually come back always, though the opportunities were phenomenal for me. Those days it's kind of almost like I had the big offers from US and UK all over. But my mind and heart was always here to come back. So it wasn't a kind of a decision to do a hospital. Those days, as a children's specialist and a specialty doctor, I've done a lot of work to how to come back. I've done I did a lot of deliberation that, what is that, I should be doing when I go back to India. That was a big question. Naturally, I spoke to some hospital and explained thought process of children's hospitals. None of them bought it. So then I was left with, what else I could do. So there's few like-minded people joined me and to say that good to do a children's hospital. So that strengthened my thought process. Then we kind of went ahead and then the children's hospital, we thinking that we are creating a workplace for ourselves to kind of display our skills and to help children to kind of survive. Especially the kind of care what we have done was for sick kids, both babies and newborns and children with the emergency services, and also with the aim to build specialties. With that aim, we started the hospital. So for first 3 years time, as you know that, the hospital, we were not knowing what is a business. It was more of emotional journey, thinking that we wanted to do something good here. So we were also stuck with a lot of problems because by the end of the second year, we were almost like an NPA because we were new, the concept is new, and how to sustain as a business model, which we didn't know because it was not a choice to do a business model. It was our choice was only to do kind of a hospital, to run the hospital so that we will survive. We were not looking even profits. How do we survive while offering a good medical care? So that is how it was. I mean, it was really getting difficult. We almost packed our bags to go back. Let's sell our properties and pay the bank and then get out of the whatever we have done it. So, I mean, there's always some degree of a kind of resilience within you. Let's fight it out. Wait for some more time. Work hard. That really worked hard for us.
In fact, that's a question I want to ask you because quite often it is said that doctors don't make good businessmen when because your basic thing is to take care of the patients. Numbers are not a part of the revenue is not a part of your thought process. Because and working in London where you work for 10 years, you must have seen the kind of care that is given out there, and to bring that same care back to India. And those days in 1990s when the economy was just opening up with PV Narasimha Rao being there, how did you weather out those initial days? You rightly said by end of second year you wanted to go back, you wanted to pack up. Resilience was there, of course, but at the end of the day, you need to make money to grow, to pay the salaries, to pay the rent, everything.
Yeah, this is exactly, especially for us coming back from England. What had happened was while I was in India, I was only kind of doing a post graduation. So there's no kind of finance we are charging to the patient. So it was the government hospitals we were working. When we went to UK and worked for 8 years time, again there's no money between the patient and the doctor.
It's NHS.
It is NHS. So for us coming back and doing a hospital where there is your motive is to do the great care and the save as many as children, but other side of it is there is a business involved, the revenue to be generated. So one of the things what we have seen, always I had a conflict, how do I sit and ask money when I see a patient and at the end of the patient, this is my consultation. That was a difficult part for it. So when we done the hospital, so what we have done is that, yes, there need to be financial counseling. There has to be the billing department. There has to be structure.
True.
Me as a doctor, I confined myself to kind of deliver the care. This is what it is. When people have come to the private hospitals, obviously they understand, they will kind of do this. Whenever there is a kind of problem for them, so you pitch and try to help them out, kind of some consideration of the billing and those things. So the 2 years of difficulties have taught us so many things. And it's not the discipline. We've always been very disciplined with either with the medical care or with the finances of the patients and also finances of the hospital also. But at the end of the day, you need to pay for bank, you need to pay for salaries, all those things. That was the difficult part. That was the difficult part we said. But at the end of the day, when you do well, the finance follows.
It will take care of itself.
Yeah, it takes care of itself. So by third year, fourth year, we knew that we had a great traction. The people started talking about us in the city. These guys work very hard. They are delivering the excellent outcomes. very sick children are getting saved and then going home. So then young parents started rallying behind us. Then suddenly we started seeing that a lot of appreciation and a lot of patronage, and we become a choice of Children's Hospital in the city of Hyderabad by 2004. So we never looked back on that after that. In a 2 years down the line, when I had seen whatever the debts which we had, all got cleared.
And you were back in
And
the black.
nothing was changed.
Yes,
Just
sir.
the sheer volumes which we used to see, the number of patients we used to treat in intensive care services that were generating enough cash flows to take care of everything and paid back all the backlogs. So that's what transformed. By the 2006, we knew that we have a model which is scalable. So that is the time we wanted to go for expansion. We have done a 50 beds to 150 bed hospital in the same premises. So that time I could borrow bigger money and then do a hospital for 25 crores.
I remember
So
that, your hospital in Vikrampuri, which is quite a landmark actually in that area. Uh, Doctor, sorry, interrupting you here. The
yeah,
thought process of, expansion, which is what your entire thing was coming to, is the fact that you wanted a hospital, a children's hospital, every 250 kilometers. I read that somewhere. Is that concept still in your mind?
yes, of course. We are working towards it actually in the larger scale. In the larger scale, in the sense, we wanted to connect entire South, the Telangana, Andhra, and Chennai, Bangalore. It's a kind of a South connect.
Okay.
We wanted to see that every 200 to 50 kilometers there is a children's hospital. We're almost there. If I connect kind of dots of Nellore and Kurnool, I've connected completely the necklace of South. So that is been a kind of our thought process. We are almost there. I think we just do two more the regional spokes in Nellore and Kurnool. So every 250 kilometers is a rainbow connecting these three major cities, Hyderabad, Bangalore and Chennai, centrally Vijayawada to Vizag to up to Coimbatore.
Somewhere in the way, you also mentioned this concept of hub and spoke.
Yeah.
You said you needed to have three big hubs, and those must be obviously Hyderabad, Bengaluru, and Chennai, and then have spokes going out from there to smaller hospitals.
So exactly I was saying that these three cities will be kind of large hubs to take care of the complexities and also sick children, and also to do a kind of to build specialities and to do a kind of the advanced care like organ transplantations. So we reached, in this process, and if you look at where we are today in a city hub and spoke, our Banjara Hills main hub hospital is about 250 beds. This 250 bed hospital is today, in 25 years of journey, I can confidently say that it is capability of our Banjara hub is as good as any mid-size American hospital.
Okay.
Both in terms of quality, what we deliver, outcomes, what we give, and also breadth and depth of the specialties, what we do, whether it is a newborn outcomes, whether it's a critical care outcomes, whether multi-organ outcomes, whether the specialty care, what we do, the amount of specialty care, what we do, and also the organ transplants, what we do, and the outcomes of organ transplants, we are no less than any advanced country's children's hospital. So that's where we are proud of, because it's happened because of a large team. We have been together, this team has been together for the last 25 years time. Almost 85% of the people, we only built teams and we lost very minimal. So we were able to do that because of the large team working together, and also we stuck like flakes now and worked together and made this concept so strong. And that's what is actually given us that thought process of that, this is the hub typically. This same hospital has to be there in Bangalore, be there in Chennai, and the regional spokes like Vijayawada, Rajahmundry, Vizag, and Coimbatore. These things will act as regional spokes about 125 to 150 bed hospitals. Connect these hubs so that the reason why we talk about hub and spoke. We've been going on the roads to pick up the children almost 300 kilometers in those days, about 2005-7. The road conditions are not good. Vijayawada is not a highway those days. To go to Vijayawada to pick up a baby, it was taking about 5 hours time. Again, to come back 5 hours time. And such a difficult when you have a thick child to go. Go to up to Nanded, go to Gulbarga, go to Nizamabad, Warangal. So we have done these transports right from 2002 on roads. All of us, like senior consul, including me, we used to go on the roads to pick up these children and babies. So over a period of time, what we understood is when you have a 200 kilometers, 250 kilometers as the regional spokes, you can rally. True. They can come up to midway, we can come to, and also we have promoted a lot of the regional side like Warangal and also we promote a lot of people to encourage them to do children's hospitals, because we have seen a lot of babies and kids are dying because of no advanced care. Today, majority of our for example in Telangana, whether it's Karimnagar, whether it's Nizamabad, whether it's Warangal, their capability is much better today. Okay. Because one of the things I always believe in is that what we have built is actually made inspiration for many other people to follow, and they started doing children's hospitals. If you look at number of children's hospitals in Telangana, is much more than any other city in the country. Okay, that is how we have influenced, not only kind of ourselves doing it, we influence others to do it as well.
From borrowing money from the banks to start your first hospital, to paying them back, and then borrowing more, and finally going public. Because that is actually the better way to finance your growth, as we obviously know. But it also brings in pressure performance quarter on quarter to show the stock market that you're doing well. At the same time, it's a very sensitive thing when you say you're making money out of healthcare. But the niche which you developed, it's only children's hospital, and the public issue that went in. What was the thought process behind going public, sir?
Firstly, there is nothing to shy about making money. Whatever it is, whether trust, including a temple or church or mosque, it has to make money. True. Because when you don't make money in the real world, it is not sustainable. So you make money for many reasons. You make money to sustain yourself, number one, to take care of your needs, advance yourself, and grow next level. So all these things leads to capital. Capital is sacrosanct. So without capital, you're arrested. So therefore, the money is an essential part of any business or healthcare, including temples. Otherwise, how would you survive? You can survive. Educational institutions, trust. We talk about trust. Trusts have to make money. So that is no question of shying about it. See, at the end of the day, any individual or any hospital group or industry makes money. It is only going for the right reasons. Tell me one promoter, healthcare promoters. We have many doctor promoters in this country, right from Pratap Reddy. What have you done with money? We are not diversified that money. All of us have invested that money back into building more beds. Not only that, we kept our families aside and made our children also doctors. And they are bringing them also back into the same thing to do it is a hard job. I think it's in a way that it is a calling. What we are trying to do, irrespective of whichever is the organization, whatever it is. I don't think they have actually diverted that money to do some other business.
So how has been the performance in the financial side over the years? 2021, you went public. Now we are in 2025. How has been I know the market capitalization is around 16,000 crores, if I'm not mistaken. But how has been I know it's difficult when you have a trust hospital to have a, profit after tax is not the thing to look at. But overall, how has been the performance?
But the performance been pretty good. Now I look at it two ways about it. So one is that now the when I go back and see that why I've done the public listing and how I borrowed money twice in the entire career entire history of Rainbow. After that, I stopped borrowing money. I raised the capital from British Institutional Investments (BII),
Okay.
and then I paid them back through the IPO proceeds.
Okay.
So they exited to the IPO. And the objective of my IPO was very different. Objectives of my IPO was not that I needed money. I could have paid off, I could have got replaced with another sovereign fund and carried on. So somehow the Rainbow Children's Hospital is the first children's hospital group is the in this country which is actually doing a great clinical care, established a good model, and it's a pilot project. It required to be known to the people who are decision maker, who are financial world of the people, even people who are a common investor or even people who invest in the capital markets.
Sure.
The visibility of your organization, your franchise, or your business will be much better when you go to public.
Brand too.
And you build your brand. Under your transparency also seen. Because once you're in public markets, your your governance structure, everything goes up significantly. I was prepared for that. So I'm not gone for to raise money for personal or to even the money. I had significant money on the balance sheet. So that is what we've seen. But that's as I expected. Today, a lot of people talk about Rainbow Children's Hospital. Even some of my other large hospital groups are thinking of doing children's hospitals, which they never thought about it. The same person, when I went to one of the large corporate hospitals in this country, they said, "Doctor, you come and prove yourself, then we'll think about it."
Now you have proved yourself.
Now not that concept was proved. Now many people wanted to replicate and buy it. So that's influence what Rainbow through public markets created is phenomenal. And also today we are the largest pediatric group in the entire English-speaking world, as the only listed children's hospital. So that I had an opportunity to evangelize what is children's. The day I went to public markets, our share tanked about 17% negative.
Okay.
So people did not know what is this children's hospital, how will it make money, whether it's kind of people kind of had no idea about the model metrics of children's hospitals and various things. So that was an opportunity for me to go around the world to evangelize this is the fundamentals of children's hospital. This is what model is required. This is a doctor engagement model. When you deliver these goods and revenue metrics will get delivered. So when I started kind of evangelizing the model once or twice, today everyone knows about it, children's hospital, how does it work, and it's inspiration to many other people.
How's your growth path looking like? Because you're now going from beyond just being a south-based hospital. There's something in the northeast that you're working on, something in Gurugram area. Can you just take us through that?
So in about 2-3 years time, we'll be kind of a formidable player in south, with Telangana, which is our hub, which is our base, Andhra Pradesh, Karnataka main cities, Tamil Nadu main 3 cities. So this is where we will be kind of stronger in these areas. In the next geography, if I think about it, whether to go to a east or north or west, I chose to go to north. So we always believe in exploring things.
Okay.
And the north is a place which is unexplored for children's hospitals. So when you look at the north today, India produces about 28 million babies.
28 million
babies a year. About 62% of these babies are born in 4 states, which is Uttar Pradesh,
Bihar,
Bihar, Haryana, and Rajasthan. So when you have 16 million babies are born there,
that's a market.
As a children's hospital player, why should I be doing it? That's where to go. So, and also, our politicians keep talking about North is sucking more money. Obviously, it is an advantage North today, because North is the time has come for the North to become more financially stronger, educationally stronger, and also businesses wise. The opportunity is big in the North. Whenever there is a growing path, growing cities, growing population is a big opportunity for especially businesses like healthcare. So another big point is that whole lot of healthcare in the North is Delhi NCR centric, because people from all over the North go to Delhi NCR for their complex treatments, which is why if we look at Fortis, Max, Apollo, all of them have built a huge number of beds, but they're doing well because of the need. And when we go and see tomorrow, this for us is a virgin market. When we go to virgin market, it takes a long time to build out, because we need to create awareness, we need to know what is your deliverables, and also create a market for yourself. So there's a huge difference between adult and children's healthcare. Adult healthcare is the patients everywhere.
True.
Because everyone is a patient after 60 years' time. You don't expect every child to be sick or requires a doctor. So this is a kind of a healthy zone. And at the same time, when they get into problem, it's an emergency. It may be genetic or metabolic or birth problems or time of the birth or infections, whatever it is. They're all serious problems. So they come always as an emergency. So children's hospital is a medical hospital. It's an emergency based. It is not elective like orthopedics or cardiac and those things. So which is why that it takes a longer time to kind of get built its reputation and name based on deliverables. And also second important thing is it's a very community driven. Okay. And we deal with young parents. It's not that easy to convince young parents that you are the great healthcare player, because unless your service standards and you build a brand, they are not going to patronize you. So these are the strong points of children's hospital. So obviously, place like Gurgaon will take some time, but when you do well and your market and opportunity is huge. Sure. When I can build 1,000 beds in Hyderabad, you can imagine how many you can do Delhi NCR. And that opens up the corridors for entire North, whether it's Lucknow or Bihar or Tri-Cities or Jaipur. So that's where it is. Northeast, you're talking about it. Northeast is something that close to my heart, because lots of children, they don't have much of a healthcare facilities. They do come all the way to Chennai, Bangalore, Hyderabad, go to Delhi. So there's a need of healthcare for children in that area, even adult healthcare. People, whoever have done multi-specialty hospitals in Northeast, they're doing reasonably well. So we should also be there. That's another thought process which is working on that.
Which brings me to birthright. Now, you have children's care being taken care of. Parents do spend a lot of money today on their children, both in education and, of course, healthcare. That is taken for granted. Now comes birthright. How did that concept evolve?
We started off as a children's hospital. Then we realized, going around the city, picking up the babies, sometimes you go little late, sometimes in time, we get a call late. So we bring the baby over to the newborn intensive care. So then you realize that we could have gone earlier and they could have called earlier. So babies already had some insult to the brain. So then we started thinking about it. Why don't we do a high-risk pregnancy within the children's hospital? So then we went ahead and done this. That's the time Dr. Pranati Reddy, who's kind of agreed to come on the board to build our perinatal services. So it is a very natural extension or backward integration what we have done. that's such a meaningful integration what you have done. I always feel, very happy about myself that doing that integration those days, because the, it's always, I always believed in best place to have a childbirth is children's hospital, because during the pregnancy, with the advances today, the fetal medicine, the high resolution scans, you pick up so many things. There may be a small cyst in the liver, there may be a small cyst in the kidneys or brain. People get panicky, people get worried about it. When you have all the children's specialty doctors there, when the neurologist sees the scan, he will say that don't worry about it. This is pretty normal. So your involvement is there right from the pregnancy. And when the babies are kind of, there is an anticipation of some problem, your entire team is there. So it's kind of seamless transition from the pregnancy, from the womb to the newborn care can happen very, very effectively in a children's hospital, which is why it is a maternal and child health. These are not two separate ones, it's one unit.
Doctor, one of the things that, since I come from a state like Kerala, where healthcare parameters are as good as the Western countries, the infant mortality ratio and maternal mortality ratio. But up north, it is pretty bad scene even now. Telangana, Tamil Nadu, Karnataka, southern states, Andhra have improved their rankings. Now, when you look at the bigger picture, beyond just a children's hospital and also, as you said, a pregnancy and high-risk pregnancies as such, do you think we are now, with the hospital like what you have and with replicable models that you may have, that we will be able to, even in the north of India, bring down that numbers to something more sensible?
I'm sure it will come. Let's put it in the south. When you said you come from Kerala, because of the significant one is woman literacy,
Correct,
woman hygiene, and also the basic health care. Kerala is a very bottom-up approach of healthcare.
PHCs are very strong.
Yeah, the basic primary, secondary healthcare have become very strong. And also there's a lot of emphasis on the childbirth. It's not only a doctor, there are many, the birthing specialists in nursing side and those things. So with the bottom-up approach, they've taken it towards healthcare. Your healthcare indicators, especially like the newborn mortality rates, infant mortality rates, even maternal mortality rates are pretty healthy. So similarly, when you come to Tamil Nadu, they've also improved their primary health care significantly. They got better. Then Andhra, Telangana, when these things, in the last government, previous government, when they've taken a lot of steps towards channelizing the deliveries towards the organized sector, it's still continuing in the current government also, because the government agreed to pay money to deliver in the hospital, which is a great move, because it's 10,000 rupees what you are giving is actually making lives much better. And you are vaccinating today.
That's true.
So overall, things kind of have gotten much, much better in the south. So there is a public, there is a private, there is a literacy, there is a combination of this. 360 degrees. This is the same thing will actually happen there in the north also. Will definitely happen, because basically the overall the per capita income is rising, and also that as we move on, the number of baby children, they also won't produce more than one or two, and also woman literacy will go up, and nutritional status will get better. These are all
Doctor, 25 years now in this line, there would be cases where the child whom you took care when they were 2 or 3 would come back to you now after 25 years, grown up, and thanked you for helping out that time, even the parents for that matter. Did you have any such cases?
Oh, of course.
Plenty of them?
Still, the girl who's actually, I went and 2000, I went and picked up from Basan Sahani, was literally kind of stopped her heart, the heartbeat. So I resuscitated and brought her to our hospital. She had a severe lung infection and advanced lung failure. We treated almost 15 days time. Her father was technocrat. He knows what it is. Then we sent her to Singapore to diagnose whatever it is. Finally, she's fine, everything. She wanted to become a doctor. She became a doctor now. She came recently to say that now.
That must be your aha moment, as they call it.
She wanted to do pediatrics.
That's even wonderful.
Yeah.
That must be the kind of satisfaction which,
no, of course, yeah,
which is something that a doctor would dream of, actually. Dr. Ramesh Kancharla,
there are many moments. Thank you.
It's wonderful speaking to you, and I'm sure that next time when we speak, we'll get into more depths of what you do in terms of subspecializations of various parts of pediatrics which you take care. And then, of course, we will detail it out then. But for today, it was wonderful speaking to you. Thank you very much.
Thank you, Suresh. Thank you. Namaste.
Ladies and gentlemen, that was Dr. Ramesh Kancharla, Chairman and Managing Director of Rainbow Hospitals. A man, a doctor with a mission, who thought and who believed that children's care needed a specialization, and they needed a hospital and a group of hospitals to run this. Today, as he operates his hub and spoke models and tries to expand all over the country, other hospital groups are also looking up to him to see a model that can be replicated. And as they say, children are tomorrow's future. And for sure, that is the way it is. Thank you for watching. Jai Hind. Okay.